So in this presentation, we are going to be discussing purchasing in healthcare. Basically, we are looking at how to procure or how to pay for healthcare services that the population is receiving. So in this presentation, we shall be able to define and explain the concept of health service procurement in the different health financing systems. And then the other thing that we'll do is we'll look at the major broad categories of health service for purchasing, and then be able to explain the different characteristics, functions, and components of the strategic health purchasing. And then we'll look at the objectives associated with strategic health purchasing. So those are basically our objectives for the session. So let's start. When we talk about purchasing, we need to remember the three functions of health financing. The first one being that we need to collect the resources, okay? And then after collecting the financial resources, now we need to now procure the, or even purchase the services that we need in order for the population to be able to receive services that they need. Okay, so you collect resources, you now allocate resources and ensure basically that everyone receives services that they need to. Please let me know if in any way the screen, you're not in position to see the screen. It appears there is always a tendency for the screen not to show, or the slides not to move. Okay, so we need to acquire the services that are needed to meet the health needs of individuals and populations within a healthcare system. So the activities associated with allocating financial resources for treatments, for medications, for equipment, and other health-related services is what we basically refer to as purchasing. So purchasing is the link between you collecting resources and being able to get the services that you need using the resources that you have. Okay, the most important aspect of purchasing is ensuring that you use resources efficiently or equitably, such that people can be able to receive services that are of high quality. Yes, so the people who provide healthcare services, we often call them providers or health providers or health workers. We can also call them the health workforce. If they are not paid for the services that they offer, we create what we call inefficiency in the healthcare system. So paying them is very, very, very important. And therefore, the concept of healthcare purchasing is very key, because it allows us to be able to pay the health workers. It allows us to know how much are we spending and on what interventions are we spending on, and whether the interventions that we are spending on are actually giving us the results that we want. Are we not wasting resources? Are we utilizing the finances right in terms of, one, paying for the health workers, two, making sure that we have very good infrastructure, three, is that we have the medicines and supplies. So it is very, 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 very important that you as healthcare managers, you know the dynamics of healthcare service purchasing. So we have two major objectives when we are doing our purchasing. We need to achieve what we call efficiency and equity. Efficiency is associated with making sure that we limit wastage of resources, such that we have optimal health outcomes. You don't want to use a lot of resources to achieve minimal health outcomes. And then equity as a concept requires us to allocate resources based on population's critical need. We usually say that equity is unequal for the unequals, that we have populations that have needs that are not similar to the others, and therefore they cannot get the same share. If you share resources equally without taking into consideration the needs of those populations, then you are not achieving what we call equity. So equity is very important to achieve. So purchasing allows us to achieve equity and efficiency, and that means therefore we are collecting resources and putting them to the right use, and we are not wasting the resources, and therefore the population is getting quality healthcare services. But again, it's very important for achievement of universal health coverage that everyone, regardless of their socioeconomic status, tribe, and other characteristics, they can access quality healthcare services. So how do we spend our resources? The government collects taxes, or even the citizens can pay for insurance, whatever strategy that exists. The government can decide to send this money to the different health facilities without looking at whether the health facilities are actually working efficiently. So this creates a problem. This is where you have passive purchasing, which is that resources are transferred to healthcare providers because the budget says that every primary healthcare center should receive 5 million SSP per quarter. So whether that primary healthcare facility works or doesn't work, that money is sent like that. Whether it receives many patients or it doesn't receive, that was what was put in the budget, and that is what is sent. That is what we call passive purchasing. Okay, and then we move to what we call strategic purchasing. Strategic purchasing is when the resources are set or transferred to health providers based on their performance and resource utilization. It is also very common that certain health facilities cannot use their annual budgets, and then by the end of the financial year they return the resources back. Okay, so it is very important to transfer resources to facilities or health providers with knowledge of how they are performing and how they are utilizing resources. When you do that, you're enhancing resource utilization, and therefore you are basically promoting efficiency. And in our developing countries, it is very important that we adopt mechanisms that do not promote wastage of resources. So if we follow the strategic health purchasing strategy, it means we are controlling the resources. So the cost of providing services can be controlled, and that the services are actually of good quality, and that the people that we give the funds are actually accountable to us, and we can have good financial systems in place for accountability, transparency, and making sure that the resources are used for the right purpose. So let us look at how these things are achieved. There should be ways in which transparency is encouraged, and that the funding is based on performance. So that means reporting is very important. Having information systems is very important to promote health system accountability. Okay, we need to achieve financial balance. The strategic health purchasing interventions are designed to achieve financial balance in healthcare by strategically allocating resources to where the health needs of the population are, without having to waste resources. Okay, so we need to control healthcare costs while maintaining the quality of healthcare services, and the strategic purchasing practices help in achieving this. Okay, we can also direct or strategic purchasing encourages or ensures that resources are directed towards purchasing only quality healthcare services and promoting improved health outcomes. So it means that if your performance in terms of health outcomes and other indicators is not optimal, then you are likely to receive less funds for the subsequent cycle of funding. The challenge with this, of course, strategic purchasing is what is recommended, but it comes with its own challenges. It's very hard to get providers who can really provide you with benefits, benefit packages that meet the needs of the population. That is, if you get other players to help you in providing the services. The services may also be of poor quality. It could be very hard to regulate the quality, But again, how you pay these providers may also be an issue. So you have challenges with provider payment mechanisms. So basically, strategic health purchasing involves you knowing what services you need and selecting who can provide those services, and then determining how you can pay those who are going to provide you those services. So you will have actors in strategic health purchasing. You have the purchaser, you will have the provider, and then you have the citizens. Basically, the government can decide to get another entity that will provide the health services to the citizens. So the government becomes the regulator. The government determines what services are supposed to be provided and to who. So there is a complex network of relationships between the regulator, the purchaser, and then the citizen. So usually you can have different agencies that can provide or different actors that can provide healthcare services, depending on the strategy that you are actually that you're going to use. So that's when you have the different stakeholders, and this is what we actually looked at when we were looking at issues to do with the risk pooling, okay, where we talked about insurance, private insurance, social health insurance, and then the other modalities. So we'll not go deep into that. So it's very important that you know how you can contract the health service providers. One strategy can be that you get an organization, a healthcare organization. That healthcare organization comes and provides healthcare services to a given group of people. So you have a contract with them. For example, you have an organization X contracts another organization Y. So if the workers of organization X become sick, they are treated by organization Y under a contract. Okay. You can have a system where you have the purchaser using their own health providers for purchasing the healthcare services. This is what we call integrated. So this is to say that you have an organization with its own health providers or health workers providing services to a given group of people, and then that is what we can call integrated system. So there are different kinds of arrangement between the individuals who want to get healthcare services and those who are going to provide healthcare services. So how do you pay? Okay, how do you pay for these services? We can have what we call fee for service. If you come for a malaria test, I perform that test and then I charge you 5,000 SSP. That is a fee for service. Then another one is what you call capitation. This is when a fixed amount of money is allocated per person that you handle regardless of the service you provide them. So I enter into an agreement with an organization that for every staff of mine who gets sick, I'm paying $10. Whether they come for a circumcision, whether they come for a dental checkup, whether they come for MRI, that is what I'm going to pay for. That is capitation. And then we have what you call value-based purchase. Yes, please.
Hello?
Yes.
Now, are you moving the screen or you're not moving the screen?
I'm moving the screen. It's not moving?
But mine, even mine now has stopped at the passive purchasing, but strategic purchasing.
Okay. Let me sort that out. I don't know what causes this, but let me sort it.
Okay.
I don't understand what causes that. Okay, so get here. So we are on slide 62. So let's upload this and see. We can move that. Okay. Uploading this here has distorted the nature of the slides, and they may need to be okay. So let me just use the method that I've been using, because this one will make me to present work that doesn't look nice. So let me share again. Every time when the slide stops moving, please you let me know such that how is that?
It's okay now, we're seeing.
Okay, so we are talking about the ways of payment. So we had stopped at capitation, where we say regardless of the service that the individuals receive, for every individual you have to pay fixed amount of money. And then we have what you call value-based purchasing, and then we have what you call diagnosis-related groups, global budgeting, and then pay per performance. We are going to look at all this in our subsequent slides. So I've explained that at the point where you receive the healthcare service, you pay an amount. So that is called fee for service. The challenge is that you can have an inflation of healthcare services, an unnecessary supply, and then you create a distortion in the market. So it is not very efficient, and some countries don't allow this. Okay, it leads to people not taking services that they may have needed because they are being charged more. Okay, so this is being encouraged. This discouraged, I mean. So capitation is what I've just explained, that you receive a given amount of money for every individual that you handle, regardless of the nature of services that they are going to receive. But of course, there is a predetermined set of services that they can receive. Okay? So we move to value-based purchasing, which is that the amount of money that is reimbursed to the health provider is related to the quality and efficiency of the patient care. So there should be value for money. Okay, value for money. You don't just receive money because you are supposed to receive it. You receive money based on the quality of care that you're providing and the health outcomes that you're having. And therefore, another aspect is also patient satisfaction. If the patients give you good ratings, this is where quality in healthcare becomes very key. If the patient comes to your health facility and then they give you low ratings, then it means that if you are expecting reimbursements based on value, then you are going to have a lot of trouble. So that's one aspect. So you look at the three parameters. Outcomes, which are basically how many people are improving when they get into the hospital. And those that have been admitted, are they readmitted again? Okay, those are indicators of quality. Okay, these are health outcomes that are indicators of quality of work that you're providing at the hospital. And then you also have what you call quality measures. Okay, are you using the latest evidence in clinical practice? Do you have guidelines? And therefore, what are the reward systems for delivering high quality healthcare service? Okay, so these indicators are the ones that are used to determine whether you will actually receive funds for providing healthcare services or not. And then you have the patients are the ones who give you a score on their experiences and how your health workers are interacting with them. Okay, so they provide this feedback to indicate whether you are providing the services in according to the expectation, in accordance with the expectations. So when you use that approach, it improves the quality of care, it controls the cost, and also the patient. That means that within the health facility, the patient is a king. That means that the care that you provide is centered around the patient. The patient participates in decision making, and that they are not at the receiving end of decisions made by health workers. That's the benefit of value-based purchasing. The challenge is that you need to have mechanisms to collect data, because it is data that will tell us the quality of care that you're providing. Because you're going to get data on waiting time, health outcomes, feedback, suggestions, whatever it is. These are very important. And also, adjusting these payments in accordance to patient risk levels may be quite difficult. So there are issues to do with implementation in relation to administrative complexity and other administrative burdens that you have on the health facilities and on health providers and administrators. To ensure that we have quality, there are things that the administration and health providers will have to do. Otherwise, the scores from the patients will be low. So those are the major challenges that can happen. There are different payment strategies that can be outside what we have mentioned. We have what you call bundled payments. that a single payment is made for a group of related healthcare services provided to a patient during a specific period of time. Okay, so that means that if a patient, maybe it is NCDs that are the chronic care for specific NCDs is what is catered for, and then the payment is made specifically for those category of diseases for a period of maybe 1 year or 2 years. That's the fee. And then we look at payment per performance, which is basically related to what we had just talked about. Performance is related to how you're providing the healthcare services. Are you over wasting resources, or you're using resources optimally? And then other strategies can include what we call cost sharing, which is that the health providers receive a portion of the cost savings achieved through efficient and cost-effective health delivery. So generally, people want quality healthcare services, but the costs for the services actually is very high. So that's the challenge that healthcare managers will have to navigate. And then you have an issue to do with addressing health disparities, where you have individuals with worse health outcomes compared to others. And then where do you want to spend resources? You need to balance between spending on achieving quality and also maybe spending on achieving services that people may need. So it is a delicate balance to make. And then we have what we call global budget, which is that a fixed payment is made in advance to cover expenditures that have been made over an extended period of time for defined services. Okay, so a payment, that means money is transferred to providers to cover for all the other expenses that have been accumulating over a given period. For example, for either or outpatient or inpatient services, depending on the arrangement. And this allows flexibility in moving different funds across the different expenditure categories. Payments can be made to providers on services such as admissions. So if a patient is admitted, then providers are given a fixed amount of fee for that admission. Okay, just because this one is agreed prior. Okay, the issue that can arise is the risk selection, and then also prioritizing less complex and expensive cases. Okay, and then we can have per diem, which is providers paid a fixed price per day for the care of an individual who is in the inpatient. Okay, and then the benefit is that it allows the hospital to have increased bed occupancy and reduce service intensity. Okay, so it shifts outpatient services to a kind of hospital setting where you have inpatients. So how do you pay the personnel? There are very many ways. Is it salaries? Is it incentives? There are many ways in which we pay health workers. Their payment is very important because it influences their motivation and their commitment to work. There are different ways in which they can be paid, but performance-based financing how the personnel is performing can be one of the ways in which they can be paid. This is to say that those who are highly performing can be given more incentives. Okay, so we have looked at all those. To be able to have proper purchasing systems, you need to look at aspects to do with making sure that you know the kind of health packages that you need. That means you need to know the health services that you need and have determined the parameters for assessing the quality. Okay, and when you do that, you will have an equitable access. Another thing that you can think about is providing, refining the ways in which you pay the providers. This is to make sure that they are motivated to be able to provide effective and efficient healthcare services. If you delay to make payments, then the quality of care will go down, and that will compromise issues to do with quality of care, efficiency, and effectiveness. Like we have seen, data is very key, especially if you're going to use what we call value-based purchasing. You need to collect data on the health outcomes and other relevant parameters to be able to know whether the health facility is providing the services that they ought to provide. You need to work with key stakeholders to be able to understand whether the healthcare services being purchased are in line with the health needs of the population. The government should always lead in implementing the purchase, the strategic purchasing of healthcare services. Thank you very much. The next session will be on efficiency, but we already have a lecture on efficiency on our YouTube channel. So you can go and look at that. Watch that lecture on efficiency.